Hello, good evening, viewers, and welcome back to your favorite medical show, Ask Dr. So. We're back on the Guyanese Critic platform, and we are also showing on. You can also catch it on Dr. Saw's Facebook page. Thank you so much for joining us all. You're still in England?
Yes, indeed, Akash, and thanks again for having me.
Yeah, quickly, Doc. I know that one of the reasons you had gone back was to help your daughter with the with her exams. How is that coming along?
Well, good news, actually. She got her results yesterday. So she, over the past month or so, she's been writing exams, and, it consists medical exam. You tend to get theory and practical aspects of it. Wow. So she got all her results yesterday, and she did well. I'm really proud of her, and I'm excited as well.
Man, no wonder you're glowing so much. Well, Doc, look, on behalf of all of us here at the studio, myself, Robert, and all the viewers out there, who've been watching, congratulations, and we wish her well.
Thank you very much. Thanks a lot. Hopefully, I'll try to lure her to come on the program at some point in time.
Absolutely, we must have her. Yeah. So, Doc, we are talking this week about upper respiratory tract infections, and this is a common thing because recently a lot of people has been suffering here in Guyana with various types of infections of the upper respiratory system, and some of it, like I had a cough and a cold that lasted for over 2 months. It was really bad and so on, and you keep going. So I'm happy that you're talking about this today. But Doc, just to start it off, tell me what is an upper respiratory tract infection?
Sure, indeed, of course. Just to define the condition, so it's an infection. Sorry, upper respiratory tract infection, as it says, the topic. It's a tract. So let us define what is the upper respiratory tract. So the respiratory tract starts from the nose and it ends at the lung. So from the nose to the lung, you have the respiratory tract. So that's the mechanism of breathing. You breathe through your nose, it goes down at the back through your windpipe, into it branches out, and then it goes to the lungs. Now the thing is, the upper respiratory tract is defined from the voice box upward. And below that, so from the voice box here, upward, it's called upper, and then you have the lower. So by definition, it's just infection of the upper tract.
Okay.
Now, we can define it, therefore, that, if it starts from the nose, so if you have infection in the nose, then it leads the nose connected to the sinuses. It leads to the sinuses. Then you go at the back of the throat. So at the back of the throat, we call it the pharynx. So pharyngitis, inflammation of pharynx, and then you have the larynx, which is the voice box area, and that is laryngitis. So any infection along that route is defined as the upper respiratory tract.
Okay, and so tell me, doctor, what are some of the signs one must look for when you have an infection?
An infection. All right, so first of all, we look at the causes, and then I'll tell you the signs. So,
yes,
an infection of respiratory tract, we know that you have infective organism. An organism can be divided into, so any infective organism, we call them pathogens. They can be divided into viruses, bacteria, fungal infections. So those are the common ones. And then, of course, you have parasites as well, but they're very uncommon to cause upper respiratory tract infection. So usually, by and large, the most common type of organism that will cause upper respiratory tract infection would be viruses, and then bacteria in that order. So viruses, the most common, and then you have a few bacterial cases, and that probably make up majority of your upper respiratory tract causes. But what are the symptoms? So all of us have had upper respiratory tract infection. You know that.
Yes.
What do you get? You get cough, you get cold, you have fever, you have sore throat, you have hoarse voice, you may have difficulty swallowing, you have aches and pains in your body, headaches, fatigue. So all the symptoms as if you're having the common cold symptoms and flu-like symptoms. Now, they are so non-specific sort of symptoms. So I will talk on upper respiratory tract as the most common thing, and then we'll go on to talk about the different separate infections on the different parts of the upper tract.
Absolutely.
So Yeah, so when you have the general upper respiratory tract infection, usually a classic virus, and those are the runny nose and fever. So that's your hallmark of the upper respiratory tract infection.
Okay. So, you know, if how can you contract it? Are upper respiratory tract infections contagious by just somebody sitting next to you coughing? You can just like how can you contract the various types of?
So normally, as I say, the majority of cases are caused by viruses, and we have lots of viruses around, and there are hundreds of viruses. And the thing is, when you have an infection with a virus, lots of times there are some viruses you can't get it again. So, for instance, if you have chicken pox,
that's right.
I don't expect you to get chicken pox twice.
Yeah.
But there is a condition where you can have, when your immune system goes down, you can have reactivation of viruses that's viruses that stay in the body. So, for instance, chickenpox can go on to form shingles.
That's right.
Later on.
Yes.
Right? But of course, you wouldn't get a chickenpox itself because there's some immunity. Your body produces some immunity, and like viruses, upper respiratory tract viruses, there are some viruses where your body produces immunity, and you wouldn't get that particular type again. And there are some where you can get it over and over, that your body would not produce that will last forever.
Okay.
So that's a basis of how your body responds and how some people respond. Some of us, you can have a virus, I can be next to you, and I wouldn't get it because I have immunity. And somebody else who even has had the previous virus before, their immune system did not respond adequately. So our body has got a mechanism where when we contract an infection, we produce antibodies to fight that infection. And those antibodies can stay with us forever, or those antibodies can disappear after a while. So we contract the same virus over a period of time, and some give you lifelong immunity. And of course, there are lots of mechanisms in the body that how it fights infection. Not only antibodies, but you have what is called some cells in the body, some type of white blood cell. They work as memory, and they store that information. So when you have another infection, they then reactivate and tackle the
That's
infection.
Amazing, yeah?
There are all sort of mechanisms. It's amazing when you go through the body and see how it fights infection. But how do we prevent it? Your question is, how do we contract it? How do we prevent it? And most viruses, they're contagious by droplet infection. So droplet infection, transmission by droplets. So if I sneeze in your face, I sneeze around you, in proximity of you, you can inhale it, it gets into the lining of the airway, and it replicates and grows, and you have an infection. But that is, it's not so common for somebody to sneeze next to you.
Yeah, that's got to be in very close proximity.
Yeah, close proximity. But the most common way I feel that it is transmitted would be you're touching things. You touch your nose.
Right.
You touch your nose.
Yes.
And then you start touching surfaces.
Yes.
And then somebody come and touch the same surface. You hold a door handle, the computer. Those are ways of transmitting it. And of course, if you share utensils and you share, personal stuff, towel and stuff like that, where you get the virus on that product and then you touch it or inhale it or wipe your face with it. So it's all about that logical, common sense hygiene, personal hygiene.
Right.
So if I have a cough or cold, I ensure I wash my hand. If I'm using sneezing into something, I dispose of it properly. And surfaces, we try to decontaminate surfaces. So we practice that a lot during the coronavirus.
Yes.
And coronavirus is an upper respiratory tract virus. So when we talk upper respiratory tract virus, I can name a few. You have rhinoviruses, adenoviruses, coronaviruses, respiratory syncytial viruses, influenza and parainfluenza viruses, and they have lots of what we call serotypes, different types of those viruses. So when you look at it, you're talking about hundreds of viruses. So the important thing to prevent the transmission is that. But lots of time, it's innocently, we don't know. We are a social being, and we interact with people all the time. and we share things, and that is how it is transmitted.
All right, well, quickly, Doc, if you can now, we can go on now to perhaps a little bit of screening. How do you screen for what is happening here, and how do you treat
Yes. All right. Yes, importantly. So normally you don't have to. We don't screen for respiratory tract viruses,
Okay.
but we diagnose it by doing certain things. And most of the time, the history tells you in your examination, because the patient come in with classical symptoms: cough, cold, runny nose, fever. That's your classical. And then depending on the severity, I will tell you about complications in a minute, and then I'll show you when do you worry. So you cause cold fever, and most of the time you don't need any test. So you can just diagnose it based on the history. You can examine the patient. What you'll find, you'll see the throat is probably red. They have a runny nose, so you see clear phlegm coming out, or yellow, whatever it is, runny nose. You can have eye symptoms where you have watery eyes, inflamed conjunctivitis. You may have mucus discharge from the ears. Of course, again, your tonsils can be inflamed. When we look at the tonsils, you have inflamed tonsils. And some patients, you can go on a little bit lower into there's not a demarcated line as such. So the virus can also involve the lungs.
Okay.
And you may have lung symptoms where you're wheezing, you're coughing. And of course, I'll find temperature, your temperature will be high if I test for your temperature. So those are your signs and symptoms. And then, of course, to diagnose it, we can do specific objective tests where we take a swab from the nasal passage. So, during coronavirus's time, I'm making reference to that because that's one of the viruses that people know how it is tested.
Yeah, it was, and the whole world was shut down for that.
Swab done, or you swab the throat.
Yeah.
And you send it to the lab. The lab would then look at it under the microscope, or there are some other types of reaction you can do. So when you look at it, you're looking for the virus, or you can look at components of the virus, DNA of a virus. So there are different ways the lab will test for it. There are times when you can have certain immunoglobulins, that is, the body react as well. So a blood test can help you as well to say that you've got a reaction to one of these. You produce antibodies to one of these viruses. And chest x-ray is generally not needed for upper respiratory tract infection, or there's no need for any other invasive or advanced testing. It's really straightforward. When we are looking for complications, then of course we would want to do other specific tests. So I like to explain this in a very simplistic way for people to remember. So I want to talk briefly on the different types of infection. When do you worry? Because that's a complication. So I have seen so many upper respiratory tract infection. It's probably one of the most common causes for
Imagine, yes.
sore throat.
Yes.
And you see it out, and that is something seasonal. Every winter time, we get so many patients coming here. So the story is, you want to tell people, when do you go to the doctor? Because yes, some countries you have free health care, and you could go to the doctor as many times as you wish. And sometimes you have to pay for health care, and you don't want to visit the doctor unnecessarily. So I would say to patients, if you have cough, cold, fever, runny nose, and you're breathing well, and and you have no complication, you're eating well, you're breathing well, you're passing urine okay, and yes, but you have fever, cough, cold, runny nose, don't panic. Give it a couple of weeks. Usually, the first week is bad. The second week, I tell patients, you're getting better by the day.
Yes.
And by the end of the second week, you should be okay. That is with our standard upper respiratory tract infection. Unless you have a complication now, that can go on for weeks and weeks, and then I will talk, I'll tell you briefly. So let us start with the nose. So you can have, the nose is connected to your sinuses. So really, you don't have a proper nose infection as such. I mean, yes, your inside of your nose can be inflamed. So you get swelling, or you get irritation in the morning, and you have redness around the nose, nostril. You can have a bit of nosebleed when you have a runny nose, because it's constant irritation in the blood vessels. So you have lots of blood vessels in the nose. So That is the nose. But usually, very rarely, you don't get that commonly, right? But if you do have that and you have a runny nose, it's related. Your sinuses. Sinus is very common. So you have blocked sinuses. Now, our sinus, why we get infection in the sinus drains into the throat.
Right.
And if that draining mechanism fails, you have a buildup of fluid, and if there's an infective organism there, it proliferates. So the thing is, you want good sinus drainage, and that's why when we do steam inhalation, we try to promote drainage of the sinuses, and when we use decongestant and all of that. Now, there are some people, so with the sinusitis, you will have fullness in the face, heaviness in the head. If you bend down, you bend to tie your shoes, or you bend to do something, you get headaches, and you feel that heaviness as you bend down. Nasal blockage, so you can't breathe well, you may not smell properly. That's your sinusitis. So sinusitis is divided into acute and chronic. So the acute one we are talking about, this is the infective type. I mean, the evidence tells us that most sinusitis, you don't even need antibiotics.
Okay.
Most sinusitis will viral related, and it will pass its course. So in the management of upper respiratory tract infection is actually supportive treatment. There is no need for any specific thing. We know a lot of times doctors give antibiotics. And sometimes you give the antibiotics because you're saying, right, it is a case whereby in case it gets complicated, the antibiotics will cover you. But really, if it is a pure upper respiratory tract infection, there's no need for antibiotics. Your body has got an immune system that will take care of it. During the corona time, we weren't treating patients for the virus. We were treating for other infections when they have complications.
Yeah.
So in the management of upper respiratory tract infection, it is actually just supportive. Temperature control, so ibuprofen, paracetamol, that is for temperature. You want to be well hydrated, so lots of fluids. There are times we can use things like nasal decongestant. We can use a spray, normal saline spray to clear the airway, because you can get mucus get stuck, they get hard, they block the airway. So you can use sprays. Inhalation can help. So steam inhalation and lots of rest. And I like to tell patients fruits and vegetables that have got lots of antioxidant and immune, just to boost the immune system.
Yeah. So
that is, yeah.
Sorry, Doc.
Sorry.
I just wanted to ask this though, because from what you're saying, is it then that in an upper respiratory tract infection, it cannot be fatal then? Fatal.
Oh, well, yes. Okay, so yes, of course. So let us talk. So that is your classic upper respiratory tract. Let us talk about when do we worry and when can it be fatal.
Right.
Of course it can be fatal. So if you were looking at complications starting from the head, and it can also get meningitis related. So I always say to patients, starting from the head, meningitis is one complication of any virus. So lots of people look at bacterial meningitis as the classic, where you have the rash and you put a glass test where you press on it, and if the rash doesn't disappear, and you have meningitis. But with meningitis, viral meningitis, sometimes you don't have that classical rash. What you get, you have headaches. The light is too bright for you, so we call that photophobia. You have neck stiffness. So when you do this, you're stretching the meninges, that is covering up the brain, and of course you get more pains. So if a patient, being an adult or a child, they've got cough, cold, runny nose, fever, headaches, the light is too bright, they can't move their head, or they get pains when they move their head, they're lethargic, they're withdrawn, altered level of consciousness, I'm panicking there. That is now a meningitis symptom. Those are meningitis symptoms.
Right. You
want that patient, see the doctor ASAP. Now, so that's one of the dangers. So that can be fatal if it is not treated adequately. Sinusitis generally is not fatal, but if you have complications, so you can have abscess formation, you can have purulent sinusitis, and the infection in the sinuses can get around the eyelid, and you can have overwhelming infection in the body, especially in patients who are immunosuppressed. So our diabetic patients, our cancer patients, our kidney patients, our heart patients, we do not, and asthma patients, we say they have a high risk of complications, so you want to get antibiotics. Probably those are the types you're choosing antibiotics for. Coming down to the throat now, so we talk sinuses, throat. There's a condition called epiglottitis. You heard of croup, right? When children have a bark and cough.
Yes.
Call that croup, right? So they describe that, and that is where the bottom of the airway is inflamed, and the majority of causes would be viral causes, but of course you can have a little bit of bacteria and other causes, in a few patients. But there is a condition called epiglottitis. That is at the back of the tongue. There's something called the epiglottis, right? And if you have inflammation of that, it causes epiglottitis. Now that can cause obstruction of your airway, and children would come in, or adults, if they present with epiglottitis, that's an emergency. That's a medical emergency, because your throat can go into spasm and it locks your airway out. And in patients, we have to intubate. We have to sometimes do emergency, make a slit in the throat just to get a tube below that so they can get air into the lung. So you don't mess around. Not all upper respiratory tract infection, they're not all innocent. So if you get a child or an adult or anyone who has got cough, cold, runny nose, fever, they look like as if they're having difficulty breathing. They cannot swallow, they cannot eat, they have to sit upright, and they have something called stridor. So this stridor is that noisy breathing. So it's a type of noisy breathing. They're struggling. They need to see the doctor. And of course, laryngitis is another hoarse throat. So when we look at complications, so we coming down sinus, tonsillitis is another one. So if you tonsils and the larynx. So let's talk about tonsillitis briefly. So your tonsils are that two little lump at the back of the throat, that two little balls, like.
Right.
You see that. So you have that thing at the back of your throat that is coming down called a uvula. In the middle, that thing that hangs.
Yes.
That's uvula. If you look at the two sides now, that's your tonsils.
Right.
Now, when they're inflamed, there will be pussy. It's red. It's really inflamed. You have sore throat. You can't swallow. Now, majority of tonsillitis, they're viral tonsillitis. But when do you want to give antibiotics? You want to give antibiotics if the tonsils are inflamed with pus. So if I look at the tonsils and they're all pussy and they have yellow pus on it, I would give antibiotics. And you can also have something called a tonsillar abscess, where the back, you'll see a swelling at the back of your throat, and it's very painful. And one side, it looks as if it's blocking up that side of the throat, and that's your tonsillitis. Laryngitis is that hoarse throat, and again, laryngitis is caused by viruses. So if in the first 2 weeks you got a hoarse throat with a viral infection, I wouldn't treat with antibiotics. If it go on longer than that and you're having high fever and difficulty swallowing, then of course those are indications when I will give antibiotics. Those are your complications generally. Of course, you can also get ear infection. So when you have your sinuses, ear, nose, and throat, they're all connected. So if you have an infection along here, it can go to the ears, and you can have discharge from the ear. Now, if you have clear discharge from the ear in children sometimes, I don't normally give antibiotics necessarily for that. That can just be a virus. So like you have clear runny nose. But once you start having pussy stuff coming out, of course I will want to give antibiotics for that, and when you have complications. And then if you do have a chest infection now, so if it goes down to the chest and you have bronchitis and pneumonia, that's another indication where I would say, fine, maybe now it's time for antibiotics because you have complications. So in summary, I think we beat for time as well.
Right. So we had about 5 minutes left, Doc. So here's what we're gonna do, viewers. As you know, the platform was down for a while, so we didn't get many questions from last week. I just have about 2 or 3 questions, and we're gonna get that into the segment now, and just do half an hour, right? Because you've covered that topic so quickly too. So can I go straight to the question, Doc, from last week? Anything else you want to say about?
Yes, go ahead. Let me just summarize.
Yeah.
I want to make one quick comment to patients then, in children, especially when I see parents bringing their children. In the first week of, if you get a child that has got cough, cold, runny nose, fever, and they're running around, they're eating and drinking and passing urine and doing things normally, and no difficulty breathing and no problem swallowing, don't need to see the doctor for that. Home remedy, your ibuprofen, lots of rest and fluids and paracetamol, control the temperature. If you start noticing symptoms of difficulty breathing, difficulty swallowing, fever not getting better after the first week, after a week or so, and the child is still high temperature, of course I would want to see the doctor. So that's your summary of upper respiratory tract and when do you see help. Questions, let's go.
Thank you, Dr. Saw. Let me ask you questions now. Doctor, can hormonal changes during menopause cause night coughs?
Good question. Hormonal changes during menopause cause night cough. I don't think it is directly related. I'm trying to see if I can theorize something. I don't think so. So, I mean, you get hot flushes, you can get palpitations, but coughing, as we know, is an irritant of the airway. So I'm just trying to link. I don't see a direct link. Indirectly, if you are, I don't know. It's a difficult one that I can't.
All right.
You know, I can't say conclusively yes to that. I would say probably not related.
All right, good. Next one here. Dr. Saw, what can acid reflux cause coughing in the night?
Very, very much so. That is one of the biggest cause of chronic cough generally. So when we talk about chronic cough the last time, I said you have respiratory condition, you have gastrointestinal and ENT. And your gastrointestinal is your reflux disease.
Right.
And your ENT would have been your respiratory sinusitis and all those throat infection and inflammation. But gastro reflux is very common. You have acid coming up, it goes to the throat, and it causes irritation, and you try to cough it up. And that's a big cause of chronic cough.
Okay, great. What can people use at night, though? If you're going to go to sleep, is there anything that you can use that you can say for acid reflux that you can use at night just to get a normal sleep?
I mean, so your common thing is I would do basic stuff. I'll tell patients not to eat and then go to bed right away. So you want to give yourself at least 2 hours after eating to go to bed. And if you have acid reflux, you may want to lie a little bit more upright in bed. So maybe lie on a pillow, 2 pillows, whatever, make you comfortable. You'd want to take some antacid. So these are your home remedies or your over-the-counter remedies. So things like Pepto-Bismol, Gaviscon, whatever home remedy, antacid stuff you can use. And if the symptoms are more, severe than that, then of course you can use acid medication. So there are a group of medication called PPI, proton pump inhibitors. They decrease production of your acid. So tablets like omeprazole and lansoprazole, those are drugs. And then they have some older ones, which is called H2 blockers, histamine, ranitidine and famotidine and those Zantac in the old days. But now we don't use that. Now we use famotidine is a commonly used one. So they have newer medication in that family group. So so that's your treatment for your acid reflux. And of course, if it persists, I would want to investigate as to what are the causes.
Last one here. Well, Dr. Saw, what about Claritin? Is that an allergy relief? Well, I know it's an allergy relief, but then you want to say, is this specific? No, is it specific?
So Claritin is an antihistamine, right? And in allergy, you have a release of histamine. So in allergic reaction, histamine is a chemical that is released in the body, and it provokes inflammation. So what you're given a drug to block histamine, and that is your anti-allergy medicine. And of course, you have different generations. So we have first generation antihistamine, that's the older type, like Piriton, chlorpheniramine, diphenhydramine. They are older antihistamine. They have more side effects like drowsiness. So sometimes I tell patients you can use a drowsy antihistamine at night. It will work as an antihistamine to take away inflammation.
Make you sleep too.
And also it makes you sleepy.
Yeah,
so
yeah,
that's
yeah.
a night remedy.
Yeah.
The new antihistamine like Claritin, loratadine, and cetirizine, they're the newer generation of antihistamine. They don't really cause so much of drowsiness, but they all do cause some degree of side effect of drowsiness. They all cause that. But yes, that can help coughing as well, especially so also if you have a type of atopic, what we call allergy-related cough. So some patients during hay fever months,
Right.
or season spring or so, they have hay fever symptoms. Your antihistamine can prevent you from coughing.
Yeah.
And then, of course, you have steroids, as in either inhaled steroids or oral tablet forms.
Okay.
But that's it for.
Yeah. All right. Thank you so much, Doc. Thank you so much for everything, all the information tonight and answering of the questions. Phenomenal again to have this wonderful program here done with you. Viewers, thank you so much for joining us again. We're back up on the platform, and you can continue to send in your questions as you always do. And we want to thank you so much for joining us. As I would always say from here, watch it for those who are not watching out for you on the roadways, and stay healthy. Anything from you, Doc? In closing?
Yeah, no. Thanks for watching, and of course, post your questions, and we can open us and recommend.